Hi everybody, thank you so much for clicking once again. You're on to Medicine on Air with Dr. Betha. Today, 28th of July is World Hepatitis Day, and so I will be discussing hepatitis. The theme for the year is break it down. The emphasis on breaking down barriers against hepatitis care, be it financial barrier, social barrier, or systemic barrier. My video is on breaking down the barriers of ignorance. Hepatitis is inflammation of the liver. Common causes are viruses, alcohol, drugs, and also some autoimmune disorders and some other diseases in the body. The emphasis on the preventable ones, the viral infections and alcohol. Viruses are different types: hepatitis B, A, C, D, and E. The emphasis on hepatitis B and C, which are the ones that can cause a chronic problem leading to the complications that kill. Worldwide, World Health Organization says more than 340 million persons are living with hepatitis B and C. 2.2 million infections are acquired annually. 1.3 million persons die. How is hepatitis transmitted? Hepatitis B is a sexually transmitted infection. It's an STI. Be it any types of sex, whether vaginal, anal, oral, manual, kissing, it can be transmitted. Another way is contaminated blood and blood products. This is common amongst the health workers, doctors, nurses, laboratory scientists who handle blood. You're doing surgeries, you're taking samples from patients, taking deliveries. Please be careful. Others include shared needles. People who are doing tattooing, piercing ear, piercing nose, and sharing needles from one person to another. You could be transmitting hepatitis. And then hepatitis A and E are transmitted through what? Food poisoning. So what can we do? Hepatitis can be acute or chronic. Acute hepatitis, the person who presents with diarrhea, fever, vomiting, jaundice, abdominal pain, weakness. Please see your doctor. At this level, a good number can be treated. But then some progress to chronic hepatitis, especially in children, young children. Chronic hepatitis is the one that will present with abdominal pain, abdominal swelling. The person will have pale stool, jaundice. Some will become confused because the liver is destroyed. Some can have cancer, and that is what causes most of the deaths. So if you have any of these, please see your doctor. Much more importantly, prevention. Number one, vaccination. Hepatitis B is part and parcel of the vaccination of children. Make sure all your children are fully vaccinated so that they are protected from hepatitis B and other diseases that immunization can protect. Adults, please also get your vaccination, especially health workers. Please make sure you're vaccinated against hepatitis B. Another one, safe sex practices. Unsafe sex is part and parcel of why there is so much mortality. Hepatitis B is a sexually transmitted infection. Avoid sharing needles. All the people who are doing things like tattooing, piercing nose, piercing ears, please do not share needles. And then finally, food hygiene. Be careful with your food. Make sure your food is safe. Thank you so much for listening. Please share this video and join me in breaking down the barrier against ignorance, thereby improving our health and preventing more deaths. Thank you so much for listening.